So to all the parents with children that have autism and are non-speaking, this is for you. What I first wanted to share here are some gems that you can apply at home that can be really impactful for the care of your kids and people you know. The most foundational systems in the brain that I think we need to start with are primarily vestibular, because this is the all-powerful vestibular system right in the heart of the brain. There is nothing more powerful than the vestibular system to activate the brain and to help synchronize and reorganize some of these imbalances. We'll call them imbalances in the brain. So the vestibular, the visual system, and the somatosensory system, these are all the receptors in your joints and your muscles and your skin and your body that allow you to feel your body. Think of this area here as being on a dimmer. And then the control of the visual system requires all parts of the brain, okay? All parts of the brain. This is the one system that relies, or that is in need of every part of the brain to work well in order to function well. And all of three of these systems need to sync up together perfectly. When they're disconnected, then your awareness of where you are in your environment and where your environment is compared to you changes. In order to improve that, we don't just want to work with one or the other, we want to sync them together. And I'm going to show you some exercises that you can do at home that help improve this synchronization, or we could call it recalibration of these systems. And that not only allows you to have better posture, movement, balance, and stability, but allows you to do everything that the brain controls better. So we've seen improvement with kids that have either learning disabilities or adults that have had concussions or that have movement disorders, and everything in between. We always start with that. This is the most powerful thing you can do for one's brain. This is one of my favorite ways to calibrate the vestibular, visual, and somatosensory systems together. We've got a weighted headband right here. It's called a halo headband. And we have laser glasses. These glasses project just a laser pointer on a target. And if you come around and see the target, you'll see that the laser is on that target. Now, not everybody can do this, but if they can do that, this is preferred. Okay, and we've got a weighted a weight here on the shoulders. It could be a weighted vest, any kind of weight that make them feel their body better, but especially the head. It could be the head only. It could be only the weight on the head by itself. This is the most important part, if they will tolerate that, okay? If they don't, then you do the best you can. And what I'm gonna do first, keep looking right here, okay, keep that laser right there, is I'm gonna translate them back, okay? The two preferred directions, if you don't have a very specific direction that you know for sure is ideal for your child, then you're just gonna go backwards. As little as 3 feet is effective, so you can do this exercise literally in 5 seconds. As long as that laser stays on the target, you want to keep going. If they won't stay focused on it and they need something more interesting to look at, then what you do is you can use an iPad or something that they're really interested in. And you want that object or whatever they're looking at to move with them. Their head, their eyes, and the target need to be perfectly in plane. The next direction that's really impactful is going to be a side movement. So keep that laser right on here, okay? Right on that target. The smaller the target, the better. So your goal is to eventually get to a very small target, the size of your thumb. But initially you may have to start with something really big that they're really interested in. So now I go to the side, and then I'm going to go to the other side. Again, if they're not staying focused, and this is something that's really hard for them to do, even if you just get 3 feet of movement while they're looking at the target, that's great. And you want that, again, you want that target, their eyes, their head to be in plane while they're moving. As soon as they lose focus, you stop, okay? It's not, no longer as beneficial if they're losing attention or they're not staying on that target. So again, what's so effective with this is the fact that they can feel the head better, they can see their head position because of the laser feedback, and it's a vestibular movement. It's a linear movement, so when we move just straight sideways, straight backwards, really, or forward, but I choose to go backwards because we move forward in our world all the time. backwards, side, side, we're activating the most powerful receptors in the brain. There's nothing more powerful than the otolithic receptors. There's a sacual and a utricle, so 2 on each side. The reason why they're the most powerful is because they are the receptors that perceive gravity, and they never turn off. They're on when you're awake, when you're sleeping. Whether you're moving or you're not moving, they are always on. But what we're finding is that when the target, your eyes and your head are perfectly in plane, and there's a linear movement, you're activating those receptors and you're recalibrating that foundational system. It's foundational, it belongs, or it lives in the brainstem and the cerebellum. So we're integrating brainstem, cerebellum function and calibrating them truly in the heart of the brain, and that is what everything else really is built on neurologically. And this comes from me, it's my opinion, but I've been seeing that over the past couple of years in practice, that if we start there, we see change in patients very fast that often appear like they're miraculous, because those are the types of change that we never thought we could see happen that quickly, but it's happening over and over on a daily basis now. So we call this method the gravity reset method. You can actually look that up if you want more information. But this is a great starting point. Again, if you, this headband is available on the Nerd Solutions website, that's NEURD Solutions. And as a disclaimer, that is a company that I started. You could probably look on Amazon if you want to buy it somewhere else. The Halo is the brand. So I don't make these, we buy them and resell them, so you can go directly to Halo. And then these glasses are also available on that same website. But again, like I said before, if you don't have the ability to stay focused, we could grab a phone or an iPad, the larger the better, and either attach a stand to it or have another person hold it while you're translating. This device right here, it's called Resimax. You can actually go on their website, resimax.com, and there's lots of videos on how to use it. We also have it on the Nerd Solutions website, and this device is new and is absolutely amazing because this mouthpiece allows you to actually put it in the mouth and stimulate every cranial nerve in the lower brainstem. The lower brainstem is the part of the brain that allows you to have control over your parasympathetic rest, digest, and heal system. That gets you out of the stress mode. All right, really, really important. But if you're having a hard time speaking, your brain is not properly connected with those regions. And so we first want to bring feedback into the brain so that the brain is more aware of those regions. So vibration is very powerful. The Resimax has a lot of different algorithms and different frequencies in there, and they also activate the vagal system, so that rest and digest system. But now you're getting it through, cranial nerve 5, cranial nerve 7, cranial nerve 12, which is the tongue, 9 and 10. That's again, these are the most powerful parasympathetic outputs. That's your vagus system. And all of that is in the medulla that controls the heart rate, the pressure, the blood pressure. And then beyond that, if we're adding in some kind of eye strategy like we just did, what we're seeing is that this calibration will improve the quality of the movement of the eyes. If you can't keep your eyes fixed, but then you move with target and head and eyes in line, you're improving gaze stability. And then pretty quickly, we can transfer that into purposeful eye movements. And so we'll talk about some apps and some other features that you can use for improving eye movement control. Now, in terms of frequency, the more often you do this, the better. It doesn't have to be done for a long duration. It could be, again, a 1-minute exercise if that's all you can fit in, but try to do that as often as possible throughout the day. So again, if you can only get it in once a day, then that's once a day. That's better than nothing. But 2, 3, the more you do it, up to every hour, the better, okay? And eventually you get to a point where you're like Houston and you can do a little bit more advanced work and have good eye stability and good eye movement control. So, so we'll move on to some other exercises. Okay, so the objective with the translation work is to eventually do it while you're standing. And again, here I'm holding a stick, but it could be a piece of cardboard with a little target on it. It could be your own hand. But the objective is to be able to step on beat to the metronome. And like I mentioned earlier, we're going to go to the right, then we're going to go to the left. The order doesn't matter too much, but mostly right, left, and backwards. And you want your feet to land on beat, okay? This is really advanced. It'll be really difficult, I think, for a lot of the kids to do that in the beginning, but just know that this is where you want to eventually be. You want to work your way up to that. And then some other exercises that can be done are using targets. And so this will have to be done passively, meaning you'll have to actually move your child's head, but we want to restore the normal vestibular reflexes. And so two things here I think that'll be really impactful. And at the very least, you can start with what we call a time zero movement. That's when you actually move the head and they follow the laser. That should be easier because the laser is attractive to look at. So basically, if you're holding the head, now I'm going to do it myself, but if you're behind your child and moving their head, you would move the head side to side, try to get to 10, but even if you only get 2 or 3 sets, that's a really good place to start, and up and down like that. And as they do this, this will actually make the quality of their eye pursuits when you're pursuing a target much cleaner, much smoother. We see changes happen seconds after doing this exercise. And the next level up from there would be actually keeping the eyes focused in the center. So you may even need to put a little sticker with a funny image on there, or maybe even somehow stick a phone on a shelf while they're doing that. And then while they're looking at the phone, you can move their head side to side. Here I had the laser, so you can actually see the laser. So eventually you want to get to this point where they're looking in the center and you go side to side 10 times and up and down 10 times. But if they're not paying attention to the laser and you need something different, again, put an iPad, or while they're watching TV, just take their head and move their head side to side and up and down. Or if you get into their face and they actually look at you, take their head and move it side to side and up and down. And eventually, if they can have this weighted headband on at the same time, it gives even more feedback. These are things you want to do throughout the day as frequently as possible. It's all about repetition. It's not about a large quantity at one time. It's about doing it frequently. So if you're doing all of these things as frequently as possible, that will give you a good chance to set a really solid foundation that you can build on. And eventually you want to move on to doing more like a purposeful eye movement training. We actually created an app called the Focus Builder app, and it's overwhelming if you look at it right now because there's a lot in there. But one of the ultimate best exercise that we want to do eventually is this one right here. This is called a right brain or a left brain exercise. And if they can tolerate doing this exercise with the headband on, this will be perfectly fine. Okay, so this is advanced, so they may not be able to do that right away, but with this particular one's done with the right hand. It's for the left brain. You have to touch the target on beat, and if you're on beat, it'll light up in green. If you're early, it'll be yellow, and then you follow the target back down. So again, that's advanced. This is something we can work up towards down the road, but this is great for the cerebellum. And then this exercise can also be done in the other direction. So we're going to just switch the direction. So now we're going to use the left hand and do the same exercise. This is a tremendous cerebellum conditioning, and not just the cerebellum, but also parts of the brainstem and the cerebral hemisphere. So this is left cerebellum, right brain. The other way around was right cerebellum, left brain. So this is, again, it's called the Focus Builder app, and there's a lot of other features, but this is what you want to work your way up to. Okay, so I'm going to show you a very simple application that is really powerful, especially to reinforce that somatosensory system. Think of your brain as having maps of your whole body, not just visual maps, but sensory maps. And we call that the homunculus, that sensory homunculus. We need to make sure that the sensory homunculus is as accurate as possible, because in order to move your body properly, you need to know exactly where your body parts are, and specifically where they begin and where they end. And that's often the problem, is those maps are completely overlapping, they're not accurate, they're kind of, we'll call them sluggish. So this is something that can be done passively for, the patient. And you'll see that Houston still has the Resimax here, because you can use this along with any other therapy. As you're combining more than one thing at a time, it's even more effective. He doesn't have to be using it right now, but if he does, it just makes it even more impactful. And so in this case, we're going to start off especially with the larger joints, the proximal joints like hips and shoulders. And what I'm going to do is I'm going to move the leg in a circular pattern, or it could be like an infinity pattern like this. And the purpose of that circular pattern is, this is considered a complex movement. Complex movements are really more impactful to do than linear movements like this, up, down. And the reason why is because when you do a complex movement, you're continually activating the cerebellum of the brain. And this is our target area, that brainstem cerebellum. If we can organize this and make it as efficient as possible, that will completely change their life experience. And so the thing with the brain is that it is plastic, right? So as you repeat an activity over and over, the brain learns. And it learns because of that cerebellum. You can learn better and faster if you have a good cerebellum. If you don't, it slows it down completely. And so these complex movements are activating the cerebellum. So if we're doing this and then we want to layer that with something else like a metronome. So if I had a metronome beating in the background, which I don't right now, but if I did, I would actually move the limb to the metronome, okay? And then at the very least, I would say do 10 reps per extremity. And I mentioned that the proximal are the most important one to begin with, but you can also get into distal extremities, and that would be like the fingers, for example. So you want them to be completely well aware of where their fingers are, where their toes are, so you can actually do this to a metronome, every digit, all the way around. And that way you're building plasticity in the brain, even though they may not be actively doing it, they're becoming more aware of where their body is, and then they're going to be able to move their body better.